Hello, my name is Faith Boyson and I'm a nursing student at HAC. Today I'm going to be demonstrating the proper way to hang an IV bag and tubing. So I'm going to start in the bedroom. I've washed my hands. I pulled my patient's MAR. I got the correct bag of fluid, and I'm just going to start through and check everything. So I labeled my bag so I could, I labeled it with Suzy Q Cicro 1150 so I could compare it to the MAR. So here I go. Suzy Q Cicro 1150. Suzy Q Cicro, Suzy Q Cicro 1150, 1150. Allergies. I'm not giving her anything with penicillin. There's no penicillin. And what I'm giving her is 0.9% normal saline, 0.9% sodium chloride, 1.25 milliliters per hour. This is 250 milliliters. There's enough there. We're at IV. This is IV fluids. Time is 8 o'clock. 0800. And the expiration date. The expiration date is good. So now I'm going to start my second check. So Suzy Q Cicro 1150, 1150, 0.9% normal saline, 0.9% sodium chloride, 125 milliliters per hour. Oh, I forgot in the first check, I forgot to mention that this is good for continuous because it says continuously here. So this is good for continuous. So I'm starting the second one now. Suzy Q Cicro 1150, 1150, 0.9% normal saline, 0.9% sodium chloride, 125 milliliters per hour. This is 250 milliliters, so there's plenty. IV, this is IV fluids, 0800, it's 0800, and this is good for be given continuously. So now I'm going to prepare my tubing. So I'm going to get my tubing, and I'm going to make sure oh, I'm sorry, I forgot to mention that I calculated everything, the dosage and everything. So my tubing bag says that it's 10 drops per minute, and I did all the math. So I have it 125 milliliters per hour times 10 drops per minute divided by 60 minutes. It equals 21 drops, about 21 drops per minute, roughly 5 drops every 15 seconds. So I did my math. And now I'm opening the tubing, so now I'm going to do the tubing. And first of all, I'm going to check my, make sure my clamp is closed. It is. Okay. Now I'm going to spike my bag. So I'm going to carefully spike my bag. I'm going to be careful to use sterile technique. So I'm going to take off the cap. Oops, sorry. I'll start that over again because I just hovered over this and I do not want to do that if I'm using sterile technique. So I'm going to take my cap off. I'm going to take my other cap off. And I'm going to connect. Being careful not to touch. Not to touch the parts that are sterile. Now I'm going to hang my bag. And I'm going to turn the camera a little bit so that you can see where I hung it. See, there's my drip chamber right there. I have it hanging on the, I have it hanging right here on a little hook on beside the window frame. So the next thing I'm going to do is that I'm going to squeeze the drip chamber. I'm going to make sure that it's between 1/3 and 1/2 full. And there, it's like half full there. So, can you see where it's at? I can see where it's at in there. I'll bring it closer. So I have it half full here. And I'm going to open my clamps now. And as the fluid flows down, I'm going to invert at each Y port so that the Y ports fill with fluid. So make sure there's no bubbles. And I'm going to invert as it goes down. Trying to get rid of any bubbles. Okay, so I'm going to invert at this Y port. So I inverted at every Y port. And now I'm going to clamp the tubing again. So I have 2 clamps for some reason, so I just use both of them because I'd rather be safe than sorry. Okay, so my IV tubing is ready. Okay, so now I am going to go into my patient's room. I have a wee little bit of a mess of water here, but it works. So I'm going to bring this back to my patient. Okay, so here's my patient. And I have all this gathered up in a basin. And I've come in with my MAR and my stuff. And first thing I'm going to do when I enter the room is say, "Hi, my name is Faith Boyce and I'm a student nurse at HEC and I'm going to wash my hands." So first thing I'm going to do is wash my hands. And then I'm going to complete my first 5. So, can you please tell me your name and date of birth? Thank you. And I'm going to pull the privacy curtain. Today, I'm going to be hanging an IV solution bag for you and changing your tubing. Do you have any allergies? Okay. Yes, I'm not giving you anything with penicillin. So the first thing I'm going to do after I've done that check, oh, yeah, I did my check and now I'm going to label. I'm going to label both my bag of fluids and my tubing with up arrow, the date and the time and my initials. So I'll just do that right now. I got it ready ahead of time so I could just simply put it on. And now I'm going to label the tubing as well. So I have that on the tubing, on my bag and my tubing. So now I'm going to put on gloves and I'm going to assess the peripheral IV site. So what I am looking for is infiltration and phlebitis. So the common findings of infiltration would be that there's swelling, it's cool to the touch, there's drainage, because when IV line is infiltrated, it means that somehow it's gone through the vein and it's flowing out into the surrounding tissue. The patient may or may not have pain. So I'm just going to assess the site for all those things. And signs of phlebitis would be like a red streak along the vein. The vein would get like rope-like instead of soft. There would be redness, there would be warmth, and those are signs of phlebitis. So at first I'm going to assess, make sure the skin is clear, assess the vein, and now I'm going to flush. I'm going to flush. Okay, here's my patient's arm. So I'm going to flush the site. So first of all, I'm going to get an alcohol pad. This did not come with a cap. It actually didn't come with one because I just opened it. It did not come with a cap. So I'm just going to say I would remove the cap and I would clean it with alcohol swab for 15 seconds.
No, you're fine.
Oh, can you see it? I'm cleaning it with the alcohol swab for 15 seconds. And now I'm going to be careful not to contaminate my sterile field. I'm going to remove my cap and using sterile technique. Okay, if this was a full syringe, I already have this, I already pulled back and let the air out of it, but if it was 10 milliliters, I would pull it back and then eject the air. And now I am going to, carefully using sterile technique, I'm going to insert, and I'm going to need to push and like kind of screw on, and then I'm going to unclamp. I'm going to inject 3 milliliters to flush it. So I'm just to make sure the cap's off the other end. So I'm going to do 3 milliliters. I'm going to do it slowly. Okay, now that's 3 milliliters. And then I'm going to reclamp. I'm going to like close my clamp again. I'm going to take it off. And I'm going to put the cap back on. Okay, now the next thing I'm going to do, I'm going to connect my IV bag. So let me just hang it here by the patient's bedside. And it's full of fluid. And the cap is on now. So I'm going to clean my port again for 15 seconds with the alcohol swab. And then using sterile technique, I'm going to carefully connect, and I need to push up and screw this part on because it's like a luer lock thingy. And then I'm going to observe the site. And next thing I'm going to do is check, adjust the drop rate. So I'm going to need to open my clamp. Okay. So my clamp is open. And I need to open this clamp down here. That's why I wasn't going, because I have my clamp on my little sites still closed. Now I opened it. Followed the rules. I started at the patient to go back up. Okay. Oh my, this is way too fast. So I'm going to adjust it. I want it about in 15 seconds. I want it to be dropping about 5 times. Okay, I have it very, very close right now. And just for the sake of time, I would just tease it a little bit more. But I think it's very close right now. So, after I've, this is a weird height. So I've adjusted my tubing, I've adjusted the drop to be the right rate. After I count the 15 seconds, I'm going to count for a full minute to make sure it's within one of 21 drops a minute. And then I'm going to, before I leave the room, I'm going to check my AV set, make sure it's patent, make sure everything went the way it was supposed to. There's no pain, redness, swelling. Patient has no complaints. And then I'm going to leave the patient comfortable, make sure they're happy, make sure the bed's at its lowest position, the call bell's within reach. I might give my patient some instruction to let me know if they start feeling any swelling or have any pain or notice any leakage. And then I'm going to document. So I'm going to sign this paper and put my name and initials on the back. I'll just do that right now. Oops, I don't have a pen. Oh, here's a pen. Okay. I'm going to date it. Oh, after I touched my patient, I took off my gloves and I washed my hands. So. Okay. And my initials. And on the back, I'm going to write I'm going to document that I did that. And so now I'm going to write a narrative documentation of what I did. So that's the end of the skill. Of course, I'm going to wash my hands when I leave the patient's room too and everything.